Like when you do your actual interview, is it going to be in person?
No, it's online.
It's online?
Mm-hmm.
Okay. So yeah, you definitely want to like, you know, good
Mm-hmm.
frame of everything. Probably nothing distracting in the background and stuff.
Okay.
That kind of thing. But as it is, let's do our first question. And this is going to be like right now, it's the real interview. It's formal. All right. So, okay.
I'm not good at this at all.
Well, don't do that on the real one. Okay.
I know I won't.
So, right now, we're going to put on our serious face.
Okay.
You can still be warm, engaging, friendly, but you need to be professional.
Mm-hmm.
I am the real interviewer as of right now.
Okay.
Okay. Here we go. Miss, what do you like most about the PA profession?
The PA profession will allow me to engage with patients and have the time available to actually learn about the patient's story. And that's very important to me as I've been a patient myself, and I know how important it is to have a relationship with the patient and instill trust in them. Um, Also, I'm a tutor and I've been teaching for a very long time now. So, keeping up with the medical info. Sorry, I'm so bad. Keeping up with my teaching degree will allow. Can I start over?
Do whatever you need to do.
Okay. Okay. The PA profession will allow me to keep teaching as well as being with patients. Something that's really interested in me is because as a PA, I'll be able to teach in a PA school as well as engage with patients in a private setting.
Is that your final answer?
I don't know. I told you I'm bad at this.
Okay. Did you want to move on to the next question?
Yes.
All right. Pretend you're in the real interview. Okay. All right. Next question. Your transcript is very impressive. Straight A's, just one single B. Can you tell me about a time when you struggled academically?
One time when I struggled academically was my first year of college. I was taking a chemistry class with a very difficult professor. And what I mean by that is he would just let us study on our own. He basically just gave us our topics and he said, "Here you go. Here's the textbook. You study on your own. The test will be on so and so date." Okay. And I'm good at studying on my own. I'm very organized and I'm very good at structuring myself to set myself up for success. But it was the first year of college and I was just getting used to college life. So when he did that, it was a bit hard for me. But what I did was I gathered two of my friends. We sit and we study together. We were very good at collaborating with each other. We helped each other out. And I was even in charge of making study guides for the whole group. So even though it was hard at first to just be thrown a book and said, "Here you go, this is for your first test," it was really important to me to sit down and collaborate with my fellow classmates and make sure we were set up for success.
Final answer?
Yes.
Okay. Why are you interested in this program?
I'm interested in this program because it allows me to have collaboration with some of the best physicians and hospitals around in the city. And in the city, it's a very diverse um, patient group. And when I am in that setting, when it comes to doing the clinical rotations, I will be exposed to different cultures and different minority groups, which is very important to me. As I shown in my application, I worked a lot with minority groups at my time at the psychiatric clinic with Dr. Tan. And so when I was looking for PA schools that I'm going to be interested in, your program showed me that I can have exposure to all these diverse groups as well as minority groups, which is very important to me because I want to be able to work in that setting in the future.
Final answer?
Mm-hmm.
Just pardon me, I'm taking some notes here, so just a few seconds after each of your answers. Can you tell me a little bit about being a book buddy volunteer?
Sure. So I always loved interacting with children. At a very young age, I was very outgoing and I love to be with other children. So when I was in high school at my local library, I saw that there was a book buddy program. And I'm like, okay, buddy, that sounds great with little kids. That's something I would be interested in. So I walked into my local library and I signed up to be the book buddy. And as soon as I started that program, it just ignited the child in me that I always want to have that inside of me because it makes me relate to children. And hopefully in my future PA profession, I will be able to work with children in the pediatric setting. So, as a book buddy, I would sit down with the book buddies and I would read them books. I would help them pick out books for future reading. And I did this throughout high school and college. And when I saw these kids reading these books and being so happy about something so simple, that's what really grabbed me. The simple things in life, especially with young kids, it's so important to keep their eyes open to the real world. It made me so happy to see. And as a future PA, it's super important to be in the moment with your patients and make sure that they are totally at ease and keep them striving for positivity. And that's something that the Book Buddies program gave me because I saw something as simple as a book really brought these children to life.
Okay. During your experience shadowing, one of your experiences, you said, I saw firsthand that PAs increase access to healthcare. After each case, I would make a PowerPoint and keep track of new medical terms and provide a framework for future research. Can you tell me about one term that you remember learning?
One term that I remember learning was doing a full workup on the patient. So actually taking the notes for the patient. Sorry, is it like it was a little bit frozen for a second? Is everything okay?
So far, yeah. If my internet goes out, just give me like 1.5 minutes and I'll switch to a
Okay.
hotspot.
Okay. So, one of the terms that I learned that was very eye opening to me was doing the full body workup. And this term came as I was looking at a patient and I saw it in their eyes that they were in a lot of pain. And the doctor was near me and he said, "Can you swallow here?" Okay. And I was like, why is the doctor making her swallow there? She had no issues with her throat. She just complained of a headache and some sinus pressure. So I was wondering, what did these symptoms have to do with the throat? I asked the doctor later on, why did he make her do that? And he said, I wanted to see if she had a goiter. And I said, "Oh, what is a goiter?" And he explained to me what it was, that it was the enlargement of the thyroid and that it could cause future problems. And he said, this is something that's often overlooked in a lot of patients. They could have thyroid problems that they're not even aware of and that don't even show in the blood work that we take. So I always ask my patients to swallow here so I could see if their thyroid is enlarged. And if the thyroid is enlarged, we can do multiple testing, such as a sonogram.
Okay. How do you handle stress?
In general, how I handle stress, I would say I do it pretty well. And there are a few steps that I take to do this. The first step is I take a step back from whatever I'm doing if I'm in a stressful situation. And what I mean by that is I take a couple of seconds to myself. I take a breathe in, I breathe out very slowly, and I tell myself, what is actually making me stressed? Because there can be a lot of environmental factors that contribute to it. So I take a step back, I breathe in, I breathe out, and I tell myself, Melina, what's going on with you? And once I target the specific problem, I tell myself, how can I make this better little by little? I don't try to make drastic changes because taking smaller steps is better for me. So, for example, if I'm having an issue um, with my students, so as a tutor, it can get very hectic around finals time where I have 10 plus students. And if I'm seeing that all of my students are asking for the same time slot, I get a bit stressed because I want to help all of them. I tell myself, how can I make this better? And for example, I made it into a group session where I can teach multiple students at the same time for the same subject. So, taking those small steps is really what helps me decompress. I don't try to tackle the situation at hand right away. I take a step back and I tell myself, what can I do to make this better slowly? And I realized that if I don't do that, I end up making rash decisions that make the problem worse later on.
Okay. And then this is me as the interviewer, not me as me asking. Do you have any questions for us?
A question that I have for you is, when I'm in my clinical rotations, what is one rotation that's specific to your program that you think stands out um, in relation to the others?
Okay. And then do you want to do a scenario question now?
Sure.
I think we should. Let's just get all the questions done and then we can do feedback. We're back. Can we have your response, please?
Sure. So the doctor in this situation, it's a very hard one, especially since the boy is very young. But since he's a minor, the doctor has to respect the parents' wishes. And that means that the doctor should not tell him about his prognosis directly. The doctor should go in and have the parents obviously near and sit down with the boy and say that they are going to do the best that they can to keep him comfortable and keep him at ease throughout this journey. Whether that means finding new hobbies the boy can do in the hospital, such as coloring, being with other patients if it's on like a pediatric unit, um, reading, playing games, watching television. The doctor should encourage that to keep the boy at ease and to keep him the most comfortable that he can be during this difficult time. And the parents should also, on their own time, have another conversation with the doctor, explaining that when the times get really rough towards the end of his journey, what the doctor should be doing. Personally, I think the doctor should sit beside the child, hold the child's hand, engage in eye contact with him to make sure that he's very comfortable, and tell him that everything's going to be okay. And even though this might be a little bit painful, that they are going to try their best to keep his pain at a minimum and use words throughout this whole time that the little boy will understand, not any hard medical jargon that he won't be able to understand because that will make him more frightened.
Okay, and cut. Official interview portion is over. How'd you feel?
It was very hard because I haven't talked about, like, this is my first time, I told you. I
Mm-hmm.
haven't done any interview in my life. Um, and I'm someone that has anxiety, like diagnosed anxiety,
Mm-hmm.
and it makes things a little bit harder for me. That's why I'm not a very good test taker, for example.
How? You have a 4.0.
I'm not good at standardized testing.
Fair.
Like a big test. If it's like a very big test, that makes me anxious. And when I'm anxious, I jumble my words.
Mm-hmm.
And in the beginning with the first question, this always happens to me. This is nothing new. If it's a first question of an exam when it's put in front of me, my head blinks and my heart starts racing.
Mm-hmm.
First question always. So that's why in the beginning, like the words like wouldn't come out of my mouth. So that's something that I have to work on. And I just have to also accept that this is who I am. And it might be a little bit shaky in the beginning. But as you saw, like as it went forward, I became more comfortable. And that's okay. Like that's just something I have to deal with. That's just who I am. I've always been this way.
Mm-hmm. Yeah, I was gonna say after that first one, I thought this was gonna be very rough. We have a lot of work to do, but then literally right after that first one, you did an exemplary job.
Okay.
Like exemplary, fantastic. Like easily
Like
top.
as you see, I'm like sweating
Good,
because
you're working hard.
that's what I said, like, after my first one, oh my god. That happens to me on every test, and that's why I got extra time on my exams
Mm-hmm.
in college, and that's why. Like, I freeze, and I'm like, "What is going on?" Like, my head goes into a different universe.
Yeah.
I've always been this way, so
So right, but it sounds like you're just accepting defeat, which you can't because
yeah,
if you do
no,
that with the
no,
program director, they may have such a bad taste in their mouth for the rest of the interview that you won't get in. You
exactly, I
can't
know,
do that.
I know.
The way
So
we don't
what
do
should
that
I
is
do? Yeah,
well, you practice.
I know.
You practice, and you don't actually have that much practicing to do because literally all of your other responses were exemplary.
I didn't think they were good.
I thought they were phenomenal.
Really?
Oh yeah, like the last guy I did like an hour ago, his were not, and I told him so. So I'm not gonna lie.
Ugh.
Yeah. So I'm really glad we're recording this because
Yes.
what I want you to do is you, whoever you trust, mom, dad, brother, sister,
Mhm.
friend, watch this together with them. So you have an objective bystander and watch that first one. I don't care how much you cringe, you're going to watch the whole thing,
Okay.
the whole one, you
Okay.
know?
Of
Okay.
course.
Have
Yes.
some sort of a snack, have whatever comforts you, but watch the whole thing and get through it and then watch the other ones and objectively compare them. The first one to every other one.
Okay.
Actually, that's a lie. Not every other one. Let me share my screen.
Okay.
Check this out. Okay. Do you see my screen?
Mm-hmm.
Okay. So the first one, what do you like most about the PA profession? The same question as why do you want to be a PA? Blah blah blah. Standard response, right? Allows me to engage with patients. You said some things. Then sorry, I'm so bad. Then can I start over? Don't do that. You're
Of
not allowed
course.
to do that. If you get nervous, you can't. I mean, they'll understand. They get that you're nervous. So if you do that, it's not the end of the world. It's okay.
So
But
can I say, so like, let's say this happens, right?
just roll
Let's
through
say
it.
I freeze. What do I do?
Just literally just level with them. Like, I'm sorry, this means so much to me. I'm just very nervous right now. Can I just have a moment to compose myself? Who in the world is not going to say okay?
Okay.
Someone might be a super hard ass, but whatever, you know? It would be much better if you didn't,
Okay.
you
I
know?
have to practice a lot. And I'll be in bed for 2 weeks. That's all I'm gonna be doing, practicing.
Practice with like the nurses and the PAs there. Like, hey, I'm applying
Oh,
to PA school. I
oh,
have an interview. Can I practice with you?
they're terrible people. They're very bad there in that hospital.
Oh, never mind.
Can't
Not
do
them.
that.
Somebody else.
Can't do that. My
Maybe
mom's
somebody
a
else.
nurse. My mom's a nurse.
I
I'll
saw
do
that.
it.
Yeah, practice with her. Practice with anybody, but do practice.
I will, of
Um,
course.
so yeah, can I start over? I'm so bad. Try not to do that. Try not to freeze up. If you do, practice what you will say. Like memorize the exact thing you'll say for freeze up, and then that'll sound smoother.
Can I
Um,
ask you a question though?
yeah, what's up?
So for the YPA question,
Yeah,
I want to steer away from the classical answer.
right.
Okay. Like the classical answer, is this a classical answer, what I'm going to say?
Okay.
So I was going to talk about how number one, I wanted to incorporate like my teaching and how being a PA will allow me to teach in a PA school as
Mhm.
well as a private practice or in a hospital. Is that like a good way to pivot it
Yeah.
or no?
Most people don't say that, so I think that's good.
Okay. Okay. So I shouldn't
Expand on
go. What? Sorry.
expand on it. Why do you want to teach?
Okay.
You know, make it convincing. Don't just be like, oh, that's something no one's ever said. Let me say this. Like, make
Yeah.
me
No, of
believe
course.
it with examples. But yeah, that's a good thing to say because no one says that.
Okay. Because there was this other route that I could take where the lateral mobility thing, but I think a lot of people talk about that.
Everybody.
And so I don't want to talk about that.
You could if it really means a lot to you, but I'd rather you do something more unique like teaching.
Okay. Because then they're going to say, like, you could be a doctor and also teach. And
It would take a lot longer.
okay. Like, are they like that in the interview? Like, are they going to ask, like, why didn't you become a doctor instead?
I guess if they do, then you can have an answer prepared and just be honest.
Okay.
I want to have a family and I want to have a better work life balance.
That's why. Okay.
Maybe make it sound a little bit more just not so just utilitarian.
Of
The
course.
training is shorter. That's it.
Okay.
That's you probably don't want to
Like,
say that. You know,
yeah.
you want to be honest, but you want to be politically correct.
Yes, and
So
also, like, I would answer because this is really a reason why I picked it, is because I'm so due to my teaching background, I love learning about multiple areas.
So
Okay.
it literally is lateral mobility for you.
Yeah.
Yeah, that's fine.
Okay. I
Yeah.
don't I want to like stand out, like I don't want to be that like monotone interview,
Right.
classical answers. That's
Okay.
not
So let's
that's
say
not me.
let's say every single person going to PA school wants to practice medicine and they like lateral mobility. Every single one, right?
Mhm.
Okay, so go with me on this. Lateral mobility and wanting to be done sooner but still practice medicine is lettuce. It's iceberg lettuce. It's dry, it's boring, everyone's had it. You can't eat a bowl of it without dressing. It's terrible. Like it's in every salad. Literally every salad is the same.
Mhm.
Do you still eat salads?
Yes.
Do you like really good ones with like different stuff on them?
Mhm.
If you had to, could you eat a salad every day as long as it was a different one every day, like a Cobb one day, a turkey bacon ranch, one
Mhm.
with like guacamole, a Mexican one, then like maybe a Mediterranean? I'd be fine with that.
Mhm.
But are you still eating lettuce?
Yep.
Okay, so you're getting the lettuce down, you're just changing it up. Why am I saying all of this? And I literally just thought of this metaphor, so I'm proud of myself. Uh, why am I saying all this is because literally everyone goes to PA school for the exact same reason. They want to practice medicine like a doctor. They don't want to spend 10, 15 years in school, and they want to be able to change specialties. That's it. So that being lettuce, how do you get the lettuce down without being bored and angry about it? It's because you put different toppings on it. So if you could lead into the lettuce a little bit more unique and then still drop the lettuce in there, no one's going to be mad at you. So in your case, the toppings are teaching,
Mhm.
right? Most people don't have a teaching background. Most people have not been a tutor for many years. Most people maybe did it for like a semester. So that's your toppings. That's your chicken bacon ranch. That's your Mediterranean, hummus and drizzle or whatever. That's the
Mhm.
way you're going to let the interviewer get the lettuce down their throat and not be mad about it. So
Okay.
like
Okay.
you lead in with that. So like,
Mhm.
why do you want to be a PA? Well, I have a teaching background. I'm very passionate about my tutoring and I love teaching. I can't imagine not doing it. So I actually really love the fact that I'd be able to teach as a PA, as a graduated PA. Yeah, maybe a master's in education somewhere down the line, but I'd love to. I love the fact that I can just teach as a professor in a program, sharing my knowledge just, with my PAC. I would love that for my career one day. Now, I probably wouldn't do that until a few years in practice,
Mhm.
particularly in a few different specialties, because someone like me, I love teaching, but I really love learning. And I feel like I would just not be able to focus on just one specialty forever. I'd really want to know more things and then bring that knowledge to my students. So ultimately, it sounds weird, but I might kind of like want to be a professor in a PA program while also practicing on the side. That's like the ideal life I see for myself.
Mhm.
So that's why I think this is a perfect profession for me.
Okay. Yep. That's exactly what I wanted to say.
Boom, memorize it.
Yep.
Well, say it your own way. But you see what I'm
Yeah.
saying?
Yes, no. That was my answer. If I
Mhm.
were to get out of my mouth, that was gonna be my answer.
Well, watch that back like 10 million times and you'll get it. It'll just start coming out of your mouth.
Yes.
I'm also going to use the lettuce metaphor with a lot more people. I think that's a good one.
That was a good one, yeah.
Well, and it's honest. It's totally honest. Everyone wants to go for the same reason. They just have like little tiny tweaks.
I think with me, I'm still like a reason why I'm also shaky is because I never wanted to be a PA. I
Oh,
never did. No, I
okay.
wanted to be a doctor. I was in a program, a pre-med program that was like 3 years and then you go straight into med school.
Yeah, yeah, those the bridge program.
Yeah, the NYIT one
Yep.
actually. And I took my MCAT and everything, and I was 1 point lower than what you needed to go on to med school, so they didn't let me go on.
You
1 point on
couldn't
my MCAT.
retake it.
I retook it and I got the same exact score.
Oh,
So,
by one
yeah,
point.
yeah, 1 point,
That's
and
insane.
they ruined my life.
That's insane. With a
Um,
4.0, like they seriously 1 point.
yep. It was a very hard time for me,
What
and
was
then
your percentile?
I didn't do well, as I said, like, I'm not good at standardized testing. Think I
Yeah,
was, like, in the 60th?
percentile.
Mhm.
Yeah, that's on the lower side for
Yeah,
sure.
but again, I was one point away and they didn't accept me. And then COVID came. And then I said, should I really take my MCAT again and
Mm,
try again and apply on my own to other med schools? And I did. I took it one more time. I got a few points higher. I
okay.
applied to NYT. They didn't accept me. And I said, do I want to try again? My parents really wanted me to. And I said, I don't think I can do it.
Mm,
Mentally, I don't think I can take the MCAT exam again. And I
mm,
said I needed to find a different route to practice medicine.
mhm.
And this, I think, is better for me in the long run anyway, because I want a family and I don't want to be not with my kids growing up. Like, I want to raise them.
Yeah, no, literally likewise, and literally again, that's why everyone's doing this.
Yeah.
We want
So
some quality of life.
there you go. That's how this came to be. And it's still a little bit hard to accept because being a doctor was instilled in my head since I'm not going to even lie to you, 6 years old.
Wow.
I would literally play with my sister and I would pretend give birth with my sister on the couch with my stuffed animals, you know?
You could still do that as a PA.
Exactly. I can still do that, but just
Mhm.
with less responsibility. And that's
Yeah, for
important
now.
to for now, yeah.
There's bridge programs and there's more of them popping up, that cut off a year of med school, cut off 2 years of med school, whatever.
Oh,
There's gonna be
really?
more of that. Oh yeah.
Well, whatever life takes me, like that's where I'm going. And I
Hmm.
think that this really gave me a boost at getting this interview acceptance because it, for so many years, it was just like there's nothing, right? No one wanted me. And it just put a lot damper on my confidence.
Hmm.
And school has been something that what is always been my thing. Like I love school, like that's my thing. And when no one accepted me, that was like, okay, well, now what do I have if I don't have school,
Right.
you know?
I could see why you want to be like a professor. You want to stay in school essentially.
Yeah, I want to be in school. Like I love teaching and I love learning and spreading my knowledge. Like
Mhm.
that's my thing.
Do you want to practice?
Yeah, of course I wanna practice. No, like, I love medicine, period.
Okay. So you do
Like
want to actually
yeah,
practice.
no, I wanna practice totally, but I also want to have that ability to teach as well.
Yeah, which you can. You don't have to
Yeah.
have any degree on top of it. The PA,
Yeah,
MPAS, that's enough.
exactly. So
Actually,
that's
whether you even pass the pants or not, you can still teach.
really?
Yeah, it would be a
But
little bit of a hard sell.
I don't think I should have an issue passing that exam because the reason also why I didn't do so good on my MCAT is because my program did not properly, um, prepare us for it.
Hmm.
Um, but obviously PA school, like I'll know my shit. Like I'll know everything,
Now,
you
PA
know?
school is literally a gigantic pants training program.
Exactly.
That's all it is.
So I'm going to have my tools,
Hmm.
right? I didn't have my tools for the MCAT, and that's why I did poorly.
So that actually leads me to one major critique I did have in the interview,
Okay.
which was this.
What?
This one. So you never want to talk negative about a professor,
Okay.
right? So this wasn't how this question was intended, but anytime there's anything negative in a question, tell me about a time you struggled,
Okay.
tell me about time you were criticized, tell me about a time something was unfair, was there a difficult patient, was there a difficult professor, what kind of patients can you absolutely not deal with, what kind of people can you not work with, all examples of the exact same question,
Okay.
right? And what they're all trying to see is if you're going to blame someone or if you're going to take responsibility. That's literally the only two things that we care about when we ask a question like that.
Okay.
Okay. So anytime you see something negative, like those
Mhm.
examples I just gave you, you do two things: overwhelming responsibility upon yourself and overwhelming empathy upon the other person or the situation, right?
Mhm.
If you can do that, you're golden. So that means in this case, one time my freshman year, my chemistry professor was very difficult. He let us study on our own. He said, here's the book. Here you go. You study on your own. I'm not
Literally.
good at studying on my own, or I'm good at studying on my own. I'm organized, which is good to say. But this first year, I was just getting used to college life. And, I was thrown a book, as you would say. I wouldn't have said that. What I would have said is, so overwhelming empathy on the person. Yeah, I actually did struggle in chemistry. I think it was general chemistry freshman year. You may have seen my transcript. That was the lowest grade I've gotten on my transcript. I wouldn't necessarily say it was my only B ever. I would say it was the lowest grade I've ever got on a transcript, just to be a little humble when you have a 4.0 essentially. And it was very difficult for me. I was just getting used to college life. It was a very tough course. There was a lot of people in it. Because there's so many people, there's just not a lot of personalized attention, which I really thrive with. Smaller groups are good. Like this program, small class is really good for me. So that's why I didn't do well. I honestly could have tried harder. I should have spent more time in this class when I realized I was struggling. I should have done more. And then later, when I had another similar situation, I actually put more work into it. And this is what I did. As opposed to the professor sucked. He didn't teach us. He threw a book at me.
I was being honest.
I know. But that's one gigantic mistake people make is they answer the question as if it's a test question. It's not. There's no right answer. It's not a test question. It's not, did you struggle? Okay, why? And then you be 100% honest. If it sounds bad, it makes you sound bad. It's still the wrong answer, even if it's right.
Makes sense.
Right? Anyway, so that's definitely a critique of that particular question. Why are you interested in this program? Collaboration with the best physicians and hospitals in the city. I'm not sure which city that is.
New York City.
Nice. Yeah, I mentioned that, or how much you love New York or whatever. Work with a lot of minorities people, blah, blah, blah. Okay, so this one you kind of ended with an upward inflection. When you watch this back, you'll see that, and I put that in your document. Work in the future. And then you ended it that way. And it's like, is she done? Is she not done? So 2 ways to end your question or end your response. One, you could literally say, and that is my final response, and that is my answer, if you want to be super easy about it, or downward inflection.
Okay.
Make it seem like you're done, because you are. So in this case, you would have said, working in the psych clinic with Dr. Tan, when I was looking for schools, your program showed me that. It sounds like I'm done. Your program showed me that? Does not sound like I'm done. Right? So verbally or non-verbally, make it clear that you're done talking.
Yes.
The reason I asked you about the book buddy is because this is how I want you to answer every question. Here, I don't know why I stopped sharing my screen. So whenever I saw that you were like nervous, and I wanted to see if like you'd be nervous throughout the whole thing, this I knew was going to make you stop being nervous, because this is just like cute and fun. And it was. You're like, I love kids. They're the best. I want to work in peds. I saw their faces light up. Like, who the hell is not going to be like that talking about kids? Right? So this is the vibe that I want throughout the entire thing.
Okay.
Now, if they're asking you about a kid with cancer, obviously be a little more solemn like you were. But, happy, flowing, good pacing, just smiling. Like, you were very confident in this answer.
Yes.
You even started with sure.
Right? Sure. Okay.
Literally, which is great. It shows confidence. Like, as soon as you ask a question and the person's like, yeah, it's like, all right, good. Or sure. Or great question. It's like, all right, cool. This person's confident. So watch yourself give this response. This was excellent.
Okay.
Absolutely excellent. During your shadowing experience, I can't remember what it was called, but I literally used a quote, which was very good. This was an excellent response. There was an example. There was what you learned. It showed that you were eager to learn. Perfect. Excellent response. This one, also excellent response. How do you handle stress? I would definitely use this as an example. Try to find an excuse to say it. Like if they say, like anything about stress academically, how are you going to handle PA school? Do you feel ready for PA school? Well, yeah, I've learned how to deal with stress, and then literally just this answer.
Okay.
Same thing with this. What's like something that really stuck out to you during your experience? Boom. Like, these are excellent stories right here. So
Okay.
find an excuse to tell them. This one's kind of basic. Do you have any questions for us?
I don't think I ever thought about this. That's why it was basic.
So
So, like,
this is something you absolutely need to have prepared because I'd be shocked if they did not ask you if you have questions.
okay.
There's almost no guarantees. This is as close to a guarantee as there is that they end their interview with, do you have any questions for me?
What are some questions I could ask?
Something more specific. So very basic questions. How does this program compare to other programs? Why did you decide to teach here instead of any other program? Why did you decide to teach in general? They're fine. They're okay questions. They can get a conversation going, but they're basic. How do you not be basic? Something specific about the program. So, I mean, just perusing their website, you could probably find something, but like it's whatever you personally really want to know.
Okay.
Is there a PEDS rotation? Can I take 2 PEDS rotations? I'm really interested in PEDS. Is there a NICU rotation? Is there a PEDS surgery rotation? I know that's specific, but can I use my elective? Do we have somebody that does that?
Okay.
I don't know. Those are just 3 that I could think of off the top of my head. Clinical associate professor. See, they're all PA degrees. Yeah. Medical director, this lady. Okay. Yeah, it doesn't say their specialties really. But yeah, I don't know. Something like that. Like, is there any faculty member that has this particular specialty? That might be good. And this one, just phenomenal. Exemplary job.
Oh,
Was
that was a good answer?
Yeah, fantastic. I didn't even write it down because I was so engaged.
Okay. I mean, that's the only way I could think of answering it.
Yeah, that was excellent.
Who's not gonna answer it that way?
Some people just freeze up. They have no idea.
Interesting. I feel like this is a very basic thing to ask.
Maybe to
And
you.
if you don't know how to answer this, you shouldn't I don't know.
Yeah. I mean, there's a lot of ways you can go with this. Like, for instance, if you're using my 4-step method to situation or scenario questions, this,
Mhm.
it would sound a little different than what you did, but I'm not going to criticize what you said because what you said was excellent. There's multiple ways to skin a cat. Me personally, I would use my method just because it's systematic. And if you practice this for scenario questions, you can answer any scenario question because you know exactly what to do. You just plug it into this little formula and boom, you have an answer, a very
Yes.
complete answer.
I'm
So
I'm gonna look at that a lot.
yeah, practice that for scenario questions. Just look up like 300 medical school MMI questions and just practice answering them with this method.
Okay.
So in this case, to apply this method, I would say, so it sounds like this poor kiddo has a terminal diagnosis. His parents don't want to tell him, maybe out of compassion, maybe they're not comfortable with the diagnosis, but they requested that we not tell them the bad news. What do I do? So that's the first step. Second step would be I'd want to know some more information. I'd probably speak with the parents first, say, why don't you want the kiddo to know about this? He's going to have to find out eventually. Is there something else going on? Is there something else going on in the life and the relationship that just it's not a good time for him to know? Does the kid not take well to bad news? Has he had a bad diagnosis before? And just gather more evidence, more information.
Mhm.
Then a couple of different scenarios, what you could possibly do. Well, one, I could disregard what the parents want and just tell the kid anyway because he has a right to know. Two, I can let the parents tell him and not say anything to the kid like they wish. Or three, I could really find out what the issue is and see if we could maybe communicate together, have the parents tell him the news with me in the room to answer any questions he might have. Boom, complete answer.
But can't you not go against the parent's wishes since he's a minor?
Um,
That's what I'm saying. Like, I think that's like against.
kind of. I mean, this is none of this is like an exact like this isn't a professional social worker board question. This is just an ethical question, like a scenario question,
Mhm.
you know? So yeah, you could go the legal route, which is something I might do. Like I would ask social work or my supervising physician if I'm even able to tell the kid if his parents don't want him to know, what my rights are here. But I think that I'm respecting everyone's rights by giving my answer too. I'm talking to the parents first.
Mhm.
Yeah. There's no perfect answer. It's just the process is the process because then it gives you a complete answer and shows that you're thinking.
I think with me, like, I'm so exam focused that I think
Mhm.
this is an exam.
It's not.
That's what I'm saying.
This is
Like,
not an exam.
I made sure to say that, he's a minor and, like, you
Mhm.
have to abide by the parents' wishes.
Yeah, that's fair. You technically do, probably, unless it has to do with mental health or sexual stuff, I think. But either way, and that's also like there's an age limit and it's state by state, so there's no perfect answer with that.
Okay.
It's not a board question. It's
They're
not
not,
a
so
legal
I just
question.
have to get out of the exam mindset.
Correct. Correct. This is all about communication, how you present. That's all it is. There's certain no-nos. There's certain things you just never ever mention, like, oh, I want to be a PA so I can make a lot of money, or I don't want to go to med school because I don't want to take that much time, or like, I don't know, stupid stuff. That's just obvious. But it's
Mhm.
just how do you present? Are you confident? Are you thoughtful? Do you talk a million miles a minute and I can't listen to you? Or, you know,
So when they give me an essay, what does that mean?
they give you an essay. They literally give you like a question like I just gave you, except it's an essay form.
So you mean like a paragraph?
Maybe a paragraph, maybe a page.
But,
They'll
like,
give you
during
30
the
minutes.
interview, you have to write it? But isn't the interview, like, in 45 minutes or something? An hour?
It's well, the whole day is going to be a lot longer than that. There's going to be like info sessions, Q&As. You're going to be there like all day.
I mean, it's on the screen, but yeah.
Well, yeah, you're going to be sitting in front of your computer all day.
All day. Okay.
Like usually like my interviews were like 8 to 4. Yeah. You're there, you're waiting, you're getting presentations, you're doing Q&As, you're doing all kinds of stuff. You got your individual interview, they have to wait through everybody. You're
Oh,
doing your group
that's
interviews.
okay.
Yeah,
That's what
there's
I
there's a
mean.
lot going on. And at one point, there's going to be breakout rooms on like Lockdown Browser. They're going to be watching you, and you're going to be writing an essay.
Oh my gosh. Okay.
Yeah,
Yeah,
that's all it is.
I don't know how this works again. I don't know much about it, but now I do.
Yeah, I mean, according to
Gotta
their website, that's how it goes, which is pretty
Mhm.
standard.
It
Individual
is?
interview, which is what we just did. Group
Okay.
interview, probably scenario question or something working in a group. And the writing sample, you literally have 10 minutes, 20 minutes, an hour, whatever, to write an essay about whatever they give you.
Okay.
Yeah,
Gotta cut my nails short to type.
I would.
Yep.
Yeah, and also for the essay, it's the same thing as practicing for the interview. Just practice writing an essay.
I'm pretty good at writing, so
There you go.
I think I'm okay with that.
Yeah, your
But I
personal
have to
statement is good.
review my application, if that makes sense.
Mhm.
I have to review everything I've done and
Yep.
because, not everything's recent.
Mhm. Yeah, and especially, like, if there's something that sticks out in any way, they're gonna ask you about it.
Okay.
That's why I asked about the book buddies thing.
Yeah, I was like, "What is book buddies?" at first. I was
Uh-huh.
like, "What?"
Yeah, that's my first piece of advice. If it's not a blind interview, if it's gonna be them reading your application, which they very well might, you need to know your application, right?
Yeah, number 1.
Yeah, and if you wanna be an a-hole, like, as an interviewer, you pick out the thing with the least amount of hours that was the longest to go to see if they stumble. It's like, "Oh, you don't remember this? This was in your application.
Wow.
Read your application." I mean, you did it. It shouldn't be hard for you to remember.
Yeah, no, but I did it, but some of it's not here right
Could
now.
be.
Yeah,
Why
it's
is it in your
coming.
application? Well, like, why are you putting this on paper for us to consider to be like, oh, this is why you should let me in if you don't even know it?
Yeah, of course.
Yeah. So
Okay.
you got some work to do, but I think if you can just like not get super nervous on the first question, you're solid. Your
Okay.
answers are really good,
Okay, thank you so much.
except for that one.
It's okay. The first one, I know.
Well, the first one and also the one where you said your professor was terrible.
Yeah, of course. But I didn't know how to answer that, but now I do.
Now you do.
So
Overwhelming
don't.
empathy and personal responsibility.
Okay, got
That's
it.
it. Pretty simple.
Got it.